I never looked back. I said, it's really not about what's right or wrong. It's really what's best for the patient. And to me, integrative medicine, combining the East and the West, is the best option for patients.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer. Here's your host, James Jacobson.
Hello, friend. Welcome to Dog Cancer Answers. If you are one of those dog lovers who has a dog with cancer and are really looking for all types of therapies that might work, from acupuncture to Chinese herbs, and you kind of get the cold shoulder as you approach your veterinarian, this episode is for you. We are speaking with Dr. Mitzi Vargas. She is a veterinarian who has been practicing for 30 years. She's in Florida, and the past dozen or so years, she has been doing integrative treatments for all types of maladies, including cancer. How much does she believe in this type of treatment plan? Enough to recommend it and to basically use it with her father, as you'll hear in this very interesting conversation. Dr. Vargas, thank you so much for being with us.
Hi, James. Thank you for inviting me. I'm very honored to be in your show today.
So you are in Florida and you have received a ton of accolades over the years, from best veterinarian in Florida to most loved veterinarian. I want to find out what that is. That's a lot of accolades for one veterinarian.
Well, I guess if you're almost 3 decades into the business, they're going to give you at least a participation one, right? No, but I'm really honored about them. I mean, I hope it comes true that I'm very passionate about what I do, and that this to me is not just a profession, it's my vocation. And I guess that comes through, and that's why I got the accolades. But I just, I love what I do. I've been loving it since day one.
So in 3 decades of practicing veterinary medicine, how has it changed since your days when you were just a vet student at Tuskegee?
So it's been big changes in the profession, in the industry as it is. Because when I graduated almost 30 years ago, it was probably 60-40 male-dominated industry. And of course, ownership was 95% male ownership. And so nowadays is quite the opposite, swinging towards 95% of females entering the profession, and female ownership is a lot higher as well. So, those are positive things. It's getting a little bit more inclusive as a profession, more minorities in it. So that's really good too. And then on the patient side, I've seen a big dramatic change from considering pets to being out in the backyard and not quite thinking of them as part of the furniture, but, not in the same regards as we have them today. Nowadays, they are definitely part of our family. And with that shift in perception of how we take care of our pets has come a big responsibility for the veterinary profession to offer higher quality, comparable to human medicine, veterinary care. And the people also are more willing to spend money to look at research, to try options that they were not open. For example, integrative medicine. They probably were not open about that one 30 years ago. But now everything is changing towards a more open-mindedness from the consumer and the profession.
So as a veterinarian who was trained back in the old system, how did you evolve? You saw the demand, but what were the things that you did to change how you practice medicine?
Well, the big secret is you can't escape fate, right? I was trying to just come up with some topic that all my large animal faculty would not know about and would not ask me and humiliate me in the ground rounds when I was a senior back in 1994 in Tuskegee. Because, I didn't know much about horses. I was a small animal practitioner, and unfortunately, you had to know both and be proficient in both. So I decided to research the most obscure topic, and it was using acupuncture to treat laminitis in horses. And it worked. There was crickets in the audience. Nobody asked me anything. I got an A, passed the rounds, and then I put it to the side. But of course, you can't escape destiny. 15 years into practicing Western medicine, one of my beloved dogs, Hans, he started having problems with his hips, and also Sam. And Sam also had problems with his hips, but Sam was in such pain, I decided to use pharmaceuticals on him. And of course, the side effects of certain pharmaceuticals, sometimes you don't show them, and some animals are more sensitive than others. And my poor Sam got into liver failure. And of course, I was devastated, and I was able to rescue him. But that really opened the door to, I knew about acupuncture. I kind of like have an inkling there was something else. I started with energy healing, and I did get proficient about it. And I went to a seminar on reconnection energy, and that's, what I studied. And then after that, I did acupuncture, and I never looked back. I said, it's really not about what's right or wrong. It's really what's best for the patient. And to me, integrative medicine, combining the East and the West, is the best option for patients. So for my dog, he lived to be 15, which is unheard of in shepherds.
Yeah.
And, he had good quality of life, but I used everything from nutraceuticals. I started cooking for him. I did a lot of things, acupuncture, a lot of things to help him live to a really long life. And his brother, Hans, too, lived to be almost 13 and in good shape.
When you were doing that with your own dogs, was that sort of outside of what you were at that time practicing with your clients?
No, I actually, when I go for it, James, I go 100%. So, I don't dilly-dally, or I said, either I believe in it or I don't believe in it. And I use it for myself, for my family, for my pets, and for my patients. My dad had adenocarcinoma of the colon when he was 82. And, I said, well, let's just do surgery. And then I got you that. And, with herbals and things like that. And he's turned 92 this year, 10 years passed. And he did great. He opted for no chemo.
Yeah.
He just did all natural. And he's been, cancer-free for 10 years.
So the surgery and the Chinese medicine is working for Dad.
Exactly. So instead of chemo, he did not want it. And when I had the oncologist, conversation, it didn't go that well because the oncologist was sure there's 3 protocols. You just have to pick which one. And I said, well, my dad does not want to do chemo, and I'm his advocate. So I just, I know, knowing that the tumor was completely out is a different thing too.
Right.
The tumor was completely out. It was a stage 2. And so they have adenocarcinoma. So they, the lymph nodes were clear. Then I said, okay, this is a case. So also common sense, obviously, right? So knowing that, it wasn't in the lymph nodes, then I decided to strengthen his immune system and change his diet and do some lifestyle choices, like he quit drinking and doing other things that he's not supposed to do.
Dad.
And he's 92 and doing great. And just those are the things that once you ring a bell, you cannot ring it, So once you know the truth, you cannot even pretend you don't know the truth. So once I see how acupuncture works, I just can't, I'm going to give you this. So I practice integrative medicine.
Okay, so I think this is fascinating. Let's talk about this conversation that you had with your dad's oncologist, because I think it's informative of how things work in general and can be applied to dog cancer as well. So you had this conversation with the oncologist and you said, well, I'm a veterinarian and I believe in acupuncture and my dad doesn't want chemotherapy and I want to treat it this way. And the oncologist said...
He turned red and you could almost see the little, smoke coming out of his ears. And he said, that is placebo. You can't trust that. You have to take one of these options, that I think is going to be worth. And I said, I'm very happy, the word placebo, because it works the same as a nocebo. So he thinks the chemo is going to kill him. He's a grown man. And I'm not going to be the one to force him to come to do chemo, because it's going to act, the placebo can act against you or for you. And placebo is about 30 to 33% of all the healings happen through placebo. And so I just said, don't placebo me. And then I said to him, I am making an informed decision. I'm here to give you counsel. And in his situation, knowing that the lymph nodes are clear, and that it's a solitary tumor, and that he had not penetrated all the layers of the colon, and it wasn't any metastasis anywhere. That he was an excellent candidate to, after the surgical and clean margins and everything, with the surgeons did a wonderful job. So I had to sign and against medical orders. And as I'm signing in, the oncologist said, "You're signing your dad's death certificate in 6 months." So yeah, he was very, very low on the bedside manner. Probably very smart guy, but very low on the bedside manner. And I said, okay, I thought many things. I am very proud of the way my dad raised me, so that I could just say, well, you're wrong. But I really wanted to just punch him in the throat, but I didn't. And so we just focused on building his immune system. We did an herbal that I actually used and I'm probably going to get in trouble for all of this. But anyways, I did use food therapy. Chinese food therapy has the ability to heal by using the energetics of food. So there are foods that actually help break down masses. There's foods that actually influence the immune system to work better. They're anti-inflammatories. They're, a lot of things that help neurotransmitters work better so that your gut biome, so I put them on probiotics, things like that. So we did a lot of lifestyle choices and some Chinese herbals, and he's done wonderful.
So 10 years beyond, 10 years out.
Yes. And that's why if I recommend it to my dad, you can believe I am 100% bought into it. But the reason I recommended to my dad was because I had already used it in pets, and pets have no concept of placebo. They are pure studying subjects. They don't have belief systems. And so that's really great. I saw things like cancers that were not totally gone in remission, but at least stopped growing and didn't cause any problems. So, I heard somebody say we all have cancer cells. It's just the amount of them that we have in the body, and where are they and what are they doing, causing, the other functions. So the main thing, James, that I learned with East and Western approaches is that the Western approach has the mechanistic, that your machine, this arm is broken, cut it off, put another one. It's not broken, cut it off, put a prosthetic. In Chinese medicine, this arm is not working. There must be a reason. You're an ecosystem. So one system goes down, we must look for the root. What is this harmony? So I feel that it's a more holistic concept. Look at what you're eating, look at your environment, and then look at your genetics, what you came with, and your attitude. So mental attitude, tremendously. And a lot of people say, well, dogs are not positive thinkers, but stress is the number one cause of lowering the immune system. And that would really inhibit the animal's natural response to cancer or to any other challenge.
You mentioned the word nocebo a moment ago, a few moments ago. What is nocebo?
So nocebo is the evil twin of placebo. Placebo is the belief that this medication is going to help you, and somehow you inspire, I guess, your brain to concoct all these chemicals and all these neurotransmitters and substances in your body that will provide relief and healing. And they're called instantaneous healings or placebo healings. And then the nocebo is the belief that this treatment is going to harm you. And that affects the response, the clinical response. So even if it's a sugar pill and they tell you that this is a pill that is going to cause diabetes or cancer or kill you, then the people end up 30%, above 30%, roughly the same of the placebo responses, but 30% end up having the condition that they were feared. And so fear and optimism, they're two different choices that we have to make as a patient and as a provider of health. So I know the patients that I see, they come with my 100%, I am an optimistic fool. And, also realist, of course, I, tell what the expectations are. But if it's all optimism, they will all survive, or at least they live longer, or it will be a little bit more improved. So
We are going to take a break because when we come back, I want to get more into the four-legged and sometimes three-legged patients you deal with and talk a little bit about how you apply some of that in your daily practice. We'll be right back. Why on earth would anyone stay subscribed to a newsletter for dog cancer years after they no longer need it? Well, let's hear what Patricia W. has to say. She subscribed to Dog Cancer News in 2017, and she recently wrote in saying, "May God bless you for the positive and informative messages you send out. You gave me great support when my boy Surf had cancer, and I still read your emails today. You're doing a really good thing." With fans like these, it's no wonder that the editorial team here works so hard to deliver timely, impactful information to newsletter subscribers 3 times a week. You should join. It is free to subscribe, and you can get it delivered to your inbox. Just go to dogcancernews.com. Welcome back to Dog Cancer Answers. We are speaking with veterinarian Dr. Mitzi Vargas. Okay, so Dr. Vargas, we covered how you really believe this and you would do this with your dad, and 10 years later, it seems to be okay for the 92-year-old dad. So in your own practice, I'm assuming that the types of clients who come are those that are seeking out and looking for this sort of Eastern approach to blend with whatever they'd been doing. Is that fair?
Well, I have different kinds of clients because what I practice is integrative medicine. So even if you come to me with a puppy, we're going to talk about food. We're going to talk about exercise. We're going to talk about a lot of stuff that maybe other vets don't pay too much attention. But I do because I believe the environment and especially obesity is one of these predisposing factors to cancer. And the food, the quality of the food is super important to me. So I will talk to them about a lot of other stuff other than the vaccines. Probably do a blood work. Probably if there's anemia or anything like that, I'll probably early on start on my herbs and things that are supplements, nutraceuticals that will help this puppy. And I will talk about risk predispositions. So if a King Charles Cavalier Spaniel comes in, I'm going to talk about this breed. It's beautiful. I love them. They're super happy. But they are predisposed to heart disease. So you have to watch for this. This is if it's a pug, which I have 2 pugs myself, they're predisposed to all things. So, you have to keep them skinny. So it's more of a holistic approach and view of it. You're not just here to talk about the vaccines. And I do vaccine. I'm not an anti-vaxxer. I am an anti too much of anything. Mm-hmm. I'm a pro-balance. I use 3-year vaccines. I use titers in animals that have any reactions. So it's just a common sense approach. It's like taking a second and making a customized advice for this patient. Not just because all dogs at this age have to have that. Well, if you come to me for vaccines and your dog is severely underweight or something that I feel is not thriving, vaccines are, in the holistic world, vaccines are a heat toxin. I mean, I should say in Chinese medicine, they're a heat toxin, a pro-inflammatory. And so definitely it's a challenge to the immune system. So if a pet puppy comes in and I suspect they have intestinal parasites or they suspect I have something else going on, I will take care of that first. I will postpone the vaccines.
Okay.
They have a place, but it's not above everything. So it's just looking at each pet as if they are an individual with different needs and what would be best for that pet, whereas the cookie cutter approach, because dogs are definitely not cookies.
They're not. Let's talk about cancer in general. What are some of the cancers that when you're presented with them, you go like, hey, I think this is an awesome application for Chinese herbs and acupuncture?
Most solid tumors, when, they're solid masses, there are many Chinese herbals that are very good about, decreasing the size of the mass. Solid tumors respond really well to that herbal called stasis breaker.
Okay.
So I have seen lymphomas live for over a year with just herbals and prednisone and, food.
Okay. So in terms of acupuncture, because we talked a little bit about some of the Chinese herbs, but there are just so many.
Yeah,
but
there are many.
In terms of acupuncture, when do you find that most effective?
Oh, acupuncture it can apply to anything, to any internal disorders. A lot of people know acupuncture for pain, but they don't know it helps with cancer. And especially even if you're going to an oncologist post chemo, this is a rescuer. I mean, appetite shut down, then you just come to my clinic. I usually use B12 and inject it in a point on the top of the nose called Shangen. And Shangen is a point that it improves the appetite of pets, and it's very, very effective. And I also have other points to increase the immune system. There's over 170 points that you can use. And some of them are master points, regional points, or influential points. And the influential points for immune system are the ones that I use for the cancer patients and, for stamina, for energy. And I usually tell people to do not feed kibble with a cancer patient, to start cooking for them.
You have a preferred diet or just home cooked in general?
Yeah, cook for them or use canned food instead of dry kibble. That's what I meant. Like dry kibble, seems to me is a heat. It's highly pasteurized process and hardened, requires a lot of water to eat it and process it. And so the cancer is inflammatory. It's like adding fire to fire. So when you add canned food or whole foods, to the diet, then I see a better improvement. So when I do a recommendation, it's not just the herbs or the acupuncture, but usually we talk about adding some foods.
Got it. And so you talk a lot about, the heat and the cool, these are traditional Chinese medicine things. You studied at the Qi Institute, right?
Yes. It's Qi University now, excuse me.
I'm sorry. When did it become a university? It grew from an institute to a university. That's an upgrade.
Yeah. This really is a wonderful institution founded by Wu Zhen from China. And he's a doctor, veterinarian, and PhD. And he was the head of integrative medicine at the University of Florida for a while. And now, he's just at the university.
So you are, located in Florida. You're raised in Puerto Rico, although I understand born in New York.
Yeah, I'm a reverse New Rican. I was born in New York and then I'm raised in Puerto Rico.
Okay, so you were raised in Puerto Rico, practice in Florida. Are there specific types of clients that seek you out, or are you just basically how do you know if it's a good fit?
Well, in the beginning, it was just my regular clients, and I would do, for example, quality of life appointments.
Quality of life appointments?
Yeah.
What is that?
Well, people thinking about, is it time, but they're not sure. So when we do a quality of life appointment, we will just talk about what are the symptoms, how far from the normal is your pet. And so in these quality of life appointments, which were possible euthanasias, right? If, I couldn't find any, if the owner was sure, but most of these owners weren't sure.
When you say sure of what?
Sure of that euthanasia was the only thing left,
Okay.
And I said, well, we've tried everything except acupuncture, so let's just try that. And I have a paper on this. I can send you the link or...
Send me the link and we'll put it in the show notes from today's episode.
Yes, I have a paper on this. I did an analysis, meta-analysis of the patient that I saw for the first 2 years after I graduated from Qi University. And they were mostly quality of life, right? I just searched quality of life appointments. And these appointments, they live around 34 months. That was the average. One pet was living at the point that I did the paper. Most of them lived 4 or 5 years after they were sitting with me saying, I think it's time. And so it's remarkable that we can extend the life of many of these patients. Some of them were cancer. Some of them were just severe multiple organ issues and pain. And so they were not all cancers, of course, but some of them were cancers. And I have a case of a hepatocellular carcinoma. When he was 19 months, he came to me. And it was the second opinion because they have told her that he had cancer and he wasn't eating. He had lost 30 pounds. And I said, okay, well, you can definitely, either way you go, but if you're not sure, let's give it a chance. And we did acupuncture with him and herbals and food changes. And he lived until he was 11. So, of course, when you do that, if pets, we're saying that pets are changing to the level of a family member, and you go to certain doctors and they tell you that this is the end, prepare. And you come and you try acupuncture herbs and you have them for 10 years. I feel if you give me 2 weeks with my pets, 2 extra weeks, I will be eternally grateful. If you give me a year, I'll be incredulous. If you give me more than a year, I'll be like, I need some of that. I'll do it for myself, for my family, for everybody else. And that's what happened. That's how I grew organically. And by, my own clients were, recommending other people. And now I have referrals. So after 12 years doing this integrated approach, I have people, that I refer. I have people that travel 3 hours to see me. That's not uncommon. And there's a lot of other acupuncturists, but they just, nope, I want you. So I'm like, oh, I'm here for anybody that wants to come. I'll for you.
Okay. So we have people who are listening from all over the world who are dealing with dog cancer. And if they're interested in this type of approach, what do you recommend that they do in terms of finding someone who is, geographically available?
So in North America, at least, the university website has a practitioner locator where you go in there and say, find a practitioner. Also, the International Veterinary Acupuncture Society has the same resource. And the American Academy of Acupuncture, Veterinary Acupuncture, which I'm a board member on and, very involved with. We also have in the website practitioner locator. So you put your zip code and it tells you where it is. At least in North America, I think this university has it worldwide. So that's really useful. But I really will recommend to anyone that just to at least give it a try. You don't have to leave your oncologist. I don't recommend any of that. I said, what else can we do? Every time it goes through chemo, suffers for 2 weeks or the white blood cells go to the floor. Well, maybe we can do an herbal. Maybe we can do a specific acupuncture treatment to see that immune system can withstand they're useful chemotherapies, chemicals. But then let's say that if you have a mast cell tumor, I would always say a mast cell, if you can't take it out, take it out. You're not going to hear me argue about that. Yeah. There's a place for Western medicine and for Eastern medicine.
Is there ever a time that you would advocate for chemotherapy?
Yeah, if it's a young patient and if the chemotherapy has a fair success rate.
Which type of, like a CHOP protocol for lymphoma or what
exactly,
would you do?
Like that. Like that's more like standard medicine, that you have to offer it because it has a good survival time of at least a year or so. We've had some CHOP protocols that live 2 years, with the doing it and then, acupuncture. So it was the integrative approach.
Do you work hand in hand with any local veterinary oncologists?
I work with anybody.
No, but I mean, are there some that you work with a lot?
Dr. Kate, no, there was a couple of doctors that, they understand what it is. And nowadays, again, I have to say, James, when I started 12 years ago, way different. It was woo-woo, magic, witchy. Chinese herbs have heavy metals and whatnot. I use formulas that are made here in the United States, and they are checked for all of that. And they're very high quality. Number one. Number two, they don't have any animal parts. I'm vegan, so I couldn't use anything, that would be, taking pendolin or anything like that, scales or anything like that, or tigers. I would break my heart to use anything like that. I would never use anything like that. We're talking about ones that have evidence-based studies behind them, not just folklore, just evidence-based. And so I do work with some, and in the beginning, not many will refer, some will have animosity. But now, even on the referral practices like Blue Pearl, they have an integrated branch. They do rehabilitation now, they add acupuncture. I'm very excited because things are changing.
Things are changing, and you are part of the change, been doing it for 30 years. Thank you so much, Mitzi Vargas. I appreciate you being with us today.
Thank you for having me.
And I want to thank you for joining us today and hitting that play button. Here on Dog Cancer Answers, we talk to all types of veterinarians around the world who are treating dog cancer, from the latest cutting edge radiation therapy to alternative therapies as they're described, Chinese medicine, and some of these are obviously thousands of years old. We want to give you as many opportunities to understand the full spectrum of things that are available so that you can customize the right treatment plan for your dog. I'm James Jacobson. From all of us here at Dog Podcast Network, I want to wish you and your dog a very warm aloha.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcanceranswers.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.